The broadcast is now starting. All attendees are in listen-only mode.
Hi, I'm the webinar organiser, Louise King. Thank you for joining today's presentation entitled Benefits of Integrated Management Systems. Today's presenter is Dave Parr, our Head of Audit and Technical Services at the British Safety Council. Before we get started, I'd just like to explain a few housekeeping items to let you know how you can all participate in today's session. You have joined today's webinar listening through your computer speaker system by default. If you'd like to call in using the phone, just locate your audio pane and select Use Telephone. The dial-in information and access code will then be displayed. You also have the ability to ask questions using your question pane. Simply type in your question and click Send. At the end of the presentation, we will respond to your questions. If we don't have time to respond to all of them, we will answer remaining questions via email after the session. Okay, I'm now going to take you over to Dave. Let's get started.
Okay, thanks Louise, and good afternoon everyone, and thank you for taking the time out to join this short webinar session in which I will outline the concept and potential benefits of integrated management systems. As Louise mentioned, my name is Dave Parr. I am Head of Audit and Technical Services at the British Safety Council, where I have worked for the last 12 years. In the session this morning, I'm going to look at the increasing trend towards integrating management systems, and in particular outline what is meant by integrated management systems, the advantages and disadvantages of adopting this approach, the basic steps to prepare for implementing integrated management system, and take a look at some recent trends in international management standards and how the ISO High-Level Structure Guide, Annex L, provides a framework for harmonizing management systems. Many organizations have either moved or may be considering moving toward an integrated management system in order to provide an effective and coordinated approach towards their safety, health, environmental and quality management arrangements. Alternatively, some organizations may prefer to combine only two of these disciplines, or indeed merge the management of specific operational activities such as fire safety, security, data protection into one overall management system. There are undoubtedly definite advantages with this approach, including much more efficient use of resources, sharing of best practice technique within the business, and the potential harmonization of your external certifications. So what exactly do we mean by the term integrated management? When we refer to integrated management systems, then it could perhaps be best described as the integration of an organization's management systems and processes into a single framework, thereby enabling the organization to operate as a single entity with unified objectives. Integrated management is basically the coordination of management system elements such as organizational structures, strategic decision making, allocation of resources, and the processes involved for measuring, monitoring and reviewing the performance of the system. Certain elements of an integrated management system, such as work procedures that acknowledge health and safety, environmental, quality management process requirements, should already be in place within most organizations. So for example, an organization may well already have emergency plans in place to deal with the accidental release or spillage of chemicals that may have an impact on employees, the public and the general environment. Such plans and procedures will undoubtedly include common safety, health, environmental and quality aspects. So from an initial viewpoint then, the case for integrated management appears overwhelming, as it should lead to less duplication of effort and to the development of unified procedures that take into account the needs of each management discipline itself. It should, in theory at any rate, also allow expertise to be shared between the various specialisms involved. One of the key objectives of effectively managing health, safety, environment and indeed quality is fundamentally the same in each case, and that is to achieve a designated standard, performance standard, in situations where any deviation from that standard could have serious consequences. The management processes involved in safety, health, environmental and quality are also pretty much the same and are normally based on the recognised repetitive management cycle of plan, do, check, act. They will be focused upon organisational and operational risk management and mitigation. So while the case for integration of separate management systems may therefore appear very, very strong, it is well worth considering some of the potential advantages and disadvantages in a little more detail. So there are several factors that promote the case for integration. The objectives and processes of all management systems are essentially the same. A well-planned integrated management process is likely to operate much more cost-effectively than separate management systems. It also should allow decision-making that addresses the overall needs of the organisation in a more holistic and joined-up manner. Integration should reduce duplication, for example, in meetings, record keeping, audits and other documentation associated with the system. The integration of these systems should reduce the risk that resolving problems in one discipline may create new ones in another by virtue of this holistic and unified approach. An integrated management system often offers the prospect of more rewarding job roles and personal development for specialists and others in each discipline. However, it should be remembered that additional training may well be required for those given new or added responsibilities within the integrated process. If the business already has a mature and effective health, safety, environment or quality management system in place, it may be well worth using one of these as the starting point for the integration, with the other disciplines conforming to the structure. Integrated management system reviews can help ensure each element of the system develops at the same rate. In contrast, independent standalone management systems could well be at different points of maturity and develop at different rates, which can lead to incompatibility. It is much easier to bring together expertise in each discipline within an integrated process to address specific issues. Moreover, all of the specialists working together are likely to arrive at a holistic and optimum solution that fully considers the needs of each management discipline requirements. It may be easier to link the integrated system with management arrangements for other purposes, so for example specific areas related to product safety, IT, security, data protection, in cases where these are not already part of the process. Integrated management systems should minimize differences in resource allocation within separate systems, which are sometimes associated with a determination to retain current priorities despite contrary evidence. So some personnel within a health and safety or an environmental management structure may well be more effective in the promotion of their discipline. It should also minimize differences and variations in the immediacy and accuracy of feedback. So for example, quality assurance feedback is usually very timely and immediate and statistically reliable, whereas there may well be a significant delay before an organisation can have statistically significant evidence of the effectiveness of a health and safety initiative. A positive culture and strengths in one management function may usefully be carried over to the others. So what about the possible disadvantages then of adopting an integrated management approach? Well, there are several potentially valid reasons for keeping management systems largely independent of each other, and these should be considered carefully before the route to integration is taken. So for example, the existing systems may currently be very mature and very effective as independent processes. Integrating them could threaten the structure and consistency of the current arrangements. Under independent management systems, relevant specialists can continue to focus exclusively on their primary area of expertise, and so a business may not need to provide any more specialist training. Sometimes integrated management systems have a tendency to become over-centralized and therefore occasionally over-complex. and lack the capacity to consider local needs and constraints. Management and staff who may already be sceptical of perceived excessive bureaucracy in their existing system could fear that this could worsen under an integrated approach. While a business is planning and implementing an integrated management approach, they may be vulnerable. Existing procedures may fail at the moment when key personnel are focusing their attention on the development of the new system. It's therefore absolutely essential that organisations have a robust and effective management of change process in place to mitigate these lapses. System requirements may vary across the management disciplines that are to be included in the integrated process. So for example, a business may need a very simple quality management system but require a more complex health, safety or environmental management process. In this case, integration could introduce unreasonable levels of bureaucracy into the quality management aspect. So for example, an organisation that manufactures a quite straightforward product to a specific customer specification but has to use dangerous machinery and could create atmospheric waste. Conversely, thinking of an example of perhaps a graphic design company who may need a sophisticated quality management system but a comparatively straightforward health and safety or environmental process. So once again, it's not always appropriate to integrate in these circumstances. There could also be distortions in the structure of the integrated management components because existing environmental and quality management standards are internationally recognized and certifiable, whereas current health and safety standards such as OSAS 18001, although that is certifiable, does not actually follow the ISO standard structure. Looking forward to the future, as we will do shortly, ISO 45001 health and safety management system standards will be compatible with ISO 9000 and 14000 and will be internationally recognized. Health and safety and environmental management is very often underpinned by legislative requirements as a minimum standard, whereas quality management system requirements are largely determined by customer needs and expectations. A business may not also want to alter existing health, safety, environment and quality reporting lines or board level accountabilities, which an integrated management system may affect. Regulators and single discipline auditors may have difficulty evaluating the specific part of the integrated management system when it is combined with other parts outside of their competence. In contrast, auditing all elements of the system at the same time may therefore well require an audit team competent in all aspects of the system and may actually prove to be more time-consuming and demanding for the organisation than the single system approach. The independent system approach. And finally, negative culture or flaws in one system area may unwittingly be carried over to the others. This is a personal opinion now. A well-designed and effectively implemented management system, integrated management system, should be able to overcome most of these problems. Okay, so having looked at the pros and cons, there are some primary stages of analysis which should be undertaken before the business endorses and then progresses to the development of an integrated management system. So first of all, review the overall business case carefully, thinking about and considering the advantages and disadvantages that we've just highlighted. Identify the component parts of the integrated management system, the key competencies required, and consult right across the organisation and with other relevant stakeholders who may be affected, clients, customers, suppliers, etc. Keeping in consideration that some of these stakeholders and certainly employees may well have additional workload as part of the process, and their participation and support is essential in the success of the transition. Crucially, ensure top management commitment for the integrated management system and also to ensure that adequate resources will be made available. Decide on the phasing and the extent and the scope of the integration. So for example, it is possible to start to integrate policy and strategic planning processes also with certain routine and straightforward operational procedures and systems. However, the business may wish to maintain separate procedures in the short term for specific operational tasks, such as quality control techniques and statistical analysis of health and safety performance. Study the recommendations of any relevant industry-specific integrated management system standards and consider whether more support externally is needed. Okay, so once the business has decided, in principle at any rate, to integrate the management systems, the next step is to make decisions about what the business will want the integrated management system to look like and how it will be introduced as smoothly as possible. So choose the overall model and structure. Consider whether there is a need to pilot parts of the IMS, integrated management system, to confirm that they're effective before introducing the process fully. Investigate what organizational change management processes and skills are needed to introduce this system smoothly and at the same time retain the integrity and effectiveness of the existing systems during the implementation process. Decide how to analyze any training needs and which will ensure adequate competencies required for the effective implementation of the integrated process, and plan how to introduce a continuing program designed to retain the commitment of everyone involved. Once the foundations of the integrated management system have been established, the business needs to make sure that the impact of changes in standards, legislation, or best practice technique in one element of the system has a positive effect on the others. The business also needs to make sure that it's in a position to respond, for example, emergency event arrangements to a potentially significant failure affecting one or more parts of the system. Okay, so now just moving on and looking at how the trends in health, safety and environmental and quality management have evolved from a fundamentally reactive approach to a more proactive and preventive methodology. This was perhaps first reflected in the TQM approach, Total Quality Management, and has now progressed to a common framework structure for all international management standards. As more organizations move towards integrated safety, environmental and quality management systems, or at least adopt a common approach, then clearly a consistent management system model was required. BSI developed a publicly available specification for common management system requirements, which was revised in 2012, with the intention of providing a framework for integration. This publicly available specification is referenced as PAS 99, which some people will be familiar with. More recently, ISO have established a management system standard, namely Annex L, which defines a common framework and structure from which all new and revised ISO standards should be derived. The recently revised Environmental Management Standard 14001 and the revised Quality Management Standard 9001 all follow the Annex L framework requirements, and this will also be a primary component of the new international standard for health and safety management systems, ISO 45001. As many organizations are certificated to either some or all of these standards, then during adoption of an integrated approach, continued adherence to the relevant requirements is essential. The requirements of Annex L therefore clearly provide a sound basis for the integrated management system content. So looking more closely at the framework clause elements within Annex L, the 10 main component parts which form the management system are the scope, which is specific to each discipline in question, and that will need to be broadened during an integrated process. The normative references, which are subclause titles specific to each standard discipline. terms and definitions, which are common terms and accepted definitions used throughout each discipline. The context of the organisation, so understanding how the organisation can affect positively or negatively on interested parties and indeed the integrated system itself. Leadership and commitment, an absolute requirement on top management to demonstrate leadership and commitment. Planning, so objectives and planning for short and long-term performance. Support, clause 7, determine and provide resources required for the establishment, implementation, maintenance and continual improvement of the integrated process. Operation, it's fairly self-explanatory, so things like safe working procedures, control processes, etc. Clause 9 relates to performance evaluation, monitoring, measuring, evaluating and analysing performance. And improvement, obviously processes in place for identifying non-conformities, corrective actions and continual improvement. Annex L includes some interesting concepts then within the framework which are explicit clauses, and again just to emphasise that these will be explicit clauses within the new 45001 Health and Safety Standard. Let's take a closer look at two of these clause requirements. So context of the organisation then. Organisations are expected to demonstrate that they have considered the internal and external factors which are relevant to operational activities and which have the ability to influence the effectiveness of the integrated management system. This is directly related to the arrangements for organisational and operational risk profiling and the subsequent risk management processes. It's essential that organisations have the ability to identify, control and reduce relevant risks, and also to identify and act upon opportunities that are presented through this process. Some external factors which may need to be considered during this process may include political, legal and economic factors, all of which have the ability to influence strategic planning and business direction. This clause is probably reflective of a much wider strategic approach to safety, health, environmental and indeed quality management, rather than the bolt-on culture which is often observed with separate independent management systems. Another primary theme and an explicit clause within Annex L concerns leadership and stakeholder participation. Demonstration of leadership and commitment is an explicit requirement for ISO 9001 quality management and ISO 14001 environmental management. And though it could be argued that it's currently implied within OSAS 18001, so for example through management review, requirements for an appointment of a director responsible for health and safety, this will now be an explicit requirement within the new ISO 45001 standard. Organisations will, quite rightly in my view, be expected to tangibly demonstrate leadership in health, safety, environmental and quality matters from the very top level and indeed all other levels of management within the business. So how will this leadership and commitment be evidenced? This could be through ensuring that safety, health, environment and quality is an integral part of the overall strategic business planning, perhaps linked to corporate targets for example. Top management awareness of and involvement with issues and the effective implementation of the integrated system. Effective monitoring of performance and ensuring that adequate resources are provided for the effective implementation of the integrated system. And supporting leadership behaviours at all levels of management. Interestingly, there's a definition of top management within Annex L, which is a person or group of persons who direct or control an organisation at the highest level. Some people listening may be familiar with that definition. It's very, very similar to that is within the Corporate Manslaughter Act. So in terms of external certification audit processes, this will mean that the auditor now will most definitely need access to your top management personnel during the audit process. So in summary then, an integrated management system can be considered as a proactive and holistic approach to effectively managing operational and organisational risk in an efficient and proactive manner. Integrated management promotes individual and collective development and the continual improvement and if externally verified, provide stakeholders with assurance of a well-managed and progressive organisation. Thank you very much for listening, and I'll now hand you back to Louise.
Thank you, Dave. That was really useful. Okay, we've had a few questions come through. The first I can happily answer myself. Will a copy of the slides be sent over or be available after the webinar? And that is yes. If you email webinar@britsafe.org, we will happily send you a copy of the slides. Also, we will be sending around an email tomorrow with a recording of today's webinar. So you'll be able to, you'll receive that automatically about this time tomorrow. Okay, so the first question I've received is from Rob in Liverpool. He says, you referred to the new Health and Safety Management Standard, ISO 14001. Do you know when this is likely to be issued? And will it replace the OSAS 18001 immediately?
Okay, Rob. 45001, yeah, it seems to be taking an inordinate amount of time to to hit the streets, as it were. Contrary to popular belief, the latest information that I'm aware of, and British Safety Council are represented on the HS1 committee, which feeds directly into the development of 45001, is that it is back on track somewhat. So contrary to popular belief, it is still expected to be issued this year. My best guess would be around about October, November time. But yeah, it does seem to be taking quite some time. But I'm a big advocate of it, Rob. I do like 45001. It's a significant improvement on OSAS.
Thank you, Dave. Okay, the next question is from Pauline in Surrey. She says, you stated that external auditing of integrated management systems may involve an audit team to ensure all relevant disciplines within the IMS are completely verified. But could it not work the other way around, in that one auditor, suitably competent in the relevant disciplines, could carry out the audit and therefore potentially reduce the certification costs?
Yes, Pauline, it is the simple answer. It most definitely could. They're quite a rare breed, auditors who are competent in the four disciplines. Should the integrated system be the four? So the simple answer is yes, it could work the other way. Yes, I suspect that it will depend largely on the certification body and their capability, their sort of resources. But yeah, it could well prove to be more cost effective. Yes.
Great, thank you. Susan has asked, do you have any suggestions on how to persuade reluctant and sceptical leadership teams to get involved?
That's the million-dollar question, isn't it, Susan? Yeah. Yeah, I think it's about, it sounds a bit glib to say this, but it's about education, isn't it? And it's about communicating the sort of not just the adverse impacts. So what could happen individually and collectively to the business, through poor leadership and the consequences of that, but also to look at the positive side and what. Not just with health and safety and environment, but the business as a whole, and sort of staff retention, for example. A positive leadership culture and ethos can definitely influence in that direction. So I think it's about from the outset is educating top management on the benefits of the transition to integration, and taking it from there, really, Susan.
Thanks, Dave. Okay, the last question that I've received as yet is from Mike in London. Mike asks, is Annex SL readily available and where can I obtain a copy?
Yes, Mike. Annex SL is an ISO document, so you can go onto the ISO websites and order through there. Obviously, I'm pretty sure it's payable. I don't think it's a free download. British Safety Council have a white paper on Annex SL which explains how it works, and again, explores some of the details within it. So that may be another useful avenue for you if you go onto our website.
Okay, thank you, Dave. Okay, so I think that's all we have time for today. I did think you were going to mention there's a couple of workshops that we have, like face-to-face workshops we have later on this year. Dave's just going to tell you about those. Otherwise, thank you very much. If you have any other questions, please email them to webinar@britsafe.org and we will respond later on today. Okay?
Okay, yeah, sorry, I should have mentioned that. Yeah, we do have a couple of related sort of workshops and events coming up throughout this year. If you go onto our website, you'll see the venues and dates for these. This includes 14,001 and 45,001 workshops, and also legislative update events, the next one of which I'm led to believe is in Manchester on May the 25th. But again, if you go onto the website, British Safety Council website, you'll see the full itinerary and schedule of the events that we provide.
Thank you, Dave. Okay, well, everyone else, thank you very much. Thank you for your time and for listening in. And we hope you have a lovely afternoon. Thank you very much. Bye.